Jaundice is defined as the yellowish discoloration of skin and mucous membranes due to the deposition of bilirubin. Bilirubin is the final product of hemoglobin breakdown. Once formed, it is released into the bloodstream and then taken up by the liver. In the liver, bilirubin is combined with glucuronic acid to form conjugated bilirubin. This conjugated bilirubin is then excreted in bile. Jaundice can occur when there is a problem in the uptake of bilirubin by the liver, or when there is a defect in the conjugation process, or when there is a problem excreting the conjugated bilirubin from the liver. In such instances, bilirubin, either conjugated or unconjugated, tends to deposit in the skin and mucous membranes, causing jaundice. So in this video, you are going to know 7 such causes of jaundice. Number 1. Hemolytic anemia. In hemolytic anemia, there is an increased breakdown of red blood cells, leading to an excessive release of hemoglobin. This hemoglobin is converted into unconjugated bilirubin, which can overwhelm the liver's ability to conjugate and excrete it. The excess unconjugated bilirubin accumulates in the blood, causing jaundice. Conditions such as sickle cell anemia, thalassemia, and autoimmune hemolytic anemia are common examples. Number 2. Hepatitis. Inflammation of the liver due to viral infections like hepatitis or chronic alcohol consumption damages hepatocytes. This damage impairs the liver's ability to conjugate bilirubin and excrete it into the bile ducts, leading to an accumulation of both conjugated and unconjugated bilirubin in the blood, causing jaundice. Number 3. Biliary obstruction. Blockage of the bile ducts by gallstones, tumors, or strictures prevents the normal excretion of conjugated bilirubin into the intestines. This leads to a backup of conjugated bilirubin into the bloodstream, resulting in jaundice. Conditions like common bile duct stones and cholangiocarcinoma are examples. Number 4. Cirrhosis. Cirrhosis involves the progressive scarring and dysfunction of liver tissue due to chronic liver damage from conditions such as chronic hepatitis, alcoholism, or non-alcoholic fatty liver disease. The scarring impairs liver function, including the ability to process and excrete bilirubin, leading to elevated levels of both conjugated and unconjugated bilirubin in the blood, causing jaundice. Number 5. Gilbert syndrome. Gilbert syndrome is a genetic disorder characterized by reduced activity of the enzyme glucuronidyltransferase, which is responsible for conjugating bilirubin in the liver. This results in a mild, chronic elevation of unconjugated bilirubin, which can lead to intermittent jaundice, especially during periods of fasting, illness, or stress. Number 6. Newborn jaundice. In newborns, especially preterm infants, the liver's enzymatic pathways for bilirubin conjugation are immature. This can lead to an accumulation of unconjugated bilirubin in the blood. Additionally, increased breakdown of fetal hemoglobin and a relatively higher red blood cell turnover contribute to elevated bilirubin levels. If severe, this condition can lead to kernicterus, a form of brain damage due to deposition of bilirubin in the basal ganglia of the brain. Number 7. Drug-induced liver injury. Certain medications and toxins can cause direct hepatotoxicity, leading to liver cell damage or cholestasis. Drugs such as acetaminophen in overdose, certain antibiotics, and chemotherapy agents can damage hepatocytes or bile ducts, impairing bilirubin conjugation and excretion, resulting in jaundice. This condition is known as drug-induced liver injury.